Welcome everybody. Today this is a slightly different video. This is a collaboration. Today I've got with me Bronwyn from Pronounce Aussie English. Bronwyn is a qualified speech pathologist in Australia and works with a number of people from overseas who are particularly professionals looking to get into the job market here. So welcome, Bronwyn.
Thank you. Thank you, Anthony. And so, Anthony, did you want to tell us a little bit about kind of what your role is?
Sure. So for Bronwyn's viewers, I'm a medical HR expert. Essentially, I've been a doctor for 30 odd years, mainly working in management of other doctors as well as other professionals. And I kind of have a lot of knowledge around the job application process. So I also often are helping people from other countries with some of the peculiarities of the Australian doctor job system.
Wonderful.
So what we've got planned for our viewers today is we've got a couple of doctors who've actually volunteered to do some practice interviews basically for us. So we've sent in some responses to some questions and we're just going to watch them, and then I'm going to ask Bronwyn some questions about them from an accent and language point of view, and then Bronwyn's going to ask me some questions from a content point of view. So the first doctor we've got is Dr. Svetlana. And the question Svetlana is answering is a typical question that doctors get in there as their first interview question, which is, can you tell us about your experience?
In 2012, I was conferred with a Doctor of Medicine by the Weidlich State Order of People's Friendship Medical University in Belarus. During 2012 and 2013, I undertook my medical internship. From 2013 to 2015, I worked as a general practitioner at Polyclinic 4 in Weidlich in Belarus. As a general practitioner, I diagnosed and treated patients both within the polyclinic and during home visits. From 2015 to 2017, I worked as a cardiologist at Weidlich City Hospital in Weidlich in Belarus. At the hospital, I worked both day and night shifts. My duties during the day shift included, without limitation, observing, diagnosing and treating, including pharmacologically, patient admitted to the hospital cardiology department. My duties during the night shift were the same as those during the day shift, but also included patient admitted to the hospital emergency department, in addition to those admitted to the hospital cardiology department. The average duration of a day shift was 8 hours, and of a night shift was approximately 16 hours.
So Bronwyn, having heard Svetlana, what I noticed there was some good content, but it might have been impaired by not seeming kind of natural in an Aussie English way. What would be one thing that you observed that Svetlana might be able to improve?
Yeah, so Svetlana obviously has a lot of lovely information to share about her experience working as a doctor. I think the thing that stands out to me in her speech is that you can see Svetlana is trying to highlight the important words by using rising inflection. So in our voice, when we're trying to highlight an important word, we use tone to indicate that that's an important word. But the important thing in English is also to slow down that particular stressed word and to add a pause. So in English, it's stress time language. So what we actually do is we say some words really quickly. So like of and it and the, we just skip over them and they become like of, it, the. And then other words, we really stress them. So an important word, you would really make sure you slow down and say that word, but then also rise the inflection. So it might be, and then in 2012, I went and worked as a cardiologist. So really skipping over those other words, highlighting and stressing with time and pausing the important words. I think if Svetlana could reduce some of the inflections that happen intermittently, and introduce that uneven rhythm to the conversation rather than having such a regimented rhythm. It's a bit like kind of marching, whereas in English we kind of skip and then jump and then we walk and skip and jump. Introduce a little bit more of an uneven rhythm with that stress. That would help a lot. I think the only other thing I would comment on is adding in some pauses after you say something important, because our English ears, we tune in to pausing and stress and slowness as an indicator of I'm saying something important now. So putting in that pause behind when you say something important, giving your audience a little bit of time to digest that information before moving on. So that's a really important thing, especially when you're working in such a professional context as a doctor, is to really put those pauses in, and that will also help her to reduce the rate she's talking at, which sometimes can be a little bit quick. And when you have an accent, I really encourage people to speak quite a lot slower. It's something that even people who speak English as a first language, we really need to be cautious of. It's making sure we don't speak too quickly, particularly in a professional context.
Okay, so slowing down is something that I often recommend to people in the general setting, and I think that's kind of a really good broad tip for a lot of doctors, both international and Australian as well. So
Anthony, what did you notice from that answer in terms of content? How could Svetlana improve her response?
Yeah, I think as you said, Bronwyn, there was actually some good content there as a as a reasonably short answer to an initial question. That question is actually what I call the lazy panel question. It often means that the panel haven't actually taken the time to read your CV and your application, so that they're giving you that question just so they can kind of find out who you are at the start. And that's actually kind of a good thing because it gives you the chance to start the narrative off. And so I think what Svetlana highlighted there was some of the key things that would be important for an entry-level doctor job in Australia. Things that were probably could have made it even better was to actually give the panel the 3 key points from the start that she wanted to highlight. Talking about her educational background would have obviously been one of them, but quickly then going on to the kind of recent work experience would be the key one that I heard there in terms of highlighting some of the jobs she's been doing recently. Particularly the after hours work was a really good thing to throw in, because that's what we're looking for. Can you work in some of those difficult situations, and have you had recency? And then the other thing would be, this is kind of an example to go a little bit further. They've asked you about your experience, but you've read the job description, so you know what the job involves, and it actually sounded like Svetlana had sort of looked at some of these jobs. She could have then gone on to actually talk about how her experience makes her a good candidate for the job by talking about some of the things in the selection criteria that she'd already read, which is good because it gets the panel what we call future looking. They're starting to think about how you would be a member of their team and sort of imagining that. And that's what you want to be able to do in an interview. So we've got a second clip from Oleg. In this, Oleg's being asked about the sort of skills that he brings to the job. And again, this is a common scenario for these sort of job interviews.
Question number 3. What skills do you bring with you? During my study in medical school and my further career, I have gained a wide range of medical skills, from interviewing and assessing patients with all kinds of medical conditions, such as women in labor or eclampsia state and resuscitation, to prescribing treatment, managing labor, all kinds of therapeutic conditions during pregnancy, physical examination and assessment of psychiatric conditions like postpartum psychosis and geriatric conditions among aging population. Thank you.
Yep.
So, what I noticed there with Oleg was, again, some good answers to that question, but I noticed some of the words like therapeutic and geriatric were not pronounced the way we would pronounce them in Australia. What advice would you give to Oleg?
Yeah, so Oleg also has, very typical Russian accent, as you said. And so working on some of the same things we were talking about with Svetlana in terms of stress and pausing would be beneficial. But what I did notice in terms of the segmental features, or those little speech sounds in there, what you're picking up on is the difficulty with the affricate sounds, is what we would call the ch and the j sounds. So I think it was in the word which or such, there was a bit of difficulty with the ch sound. So really just making sure, he's producing those sounds ch and the sound j in geriatric rather than geriatric would be really useful to practice. I guess particularly in the context of working in a hospital, making sure that particular word and just having a look for other words that have the j and the ch sounds in them in a medical context. Is there any other words that you would, just putting on the spot, but any other words that you would think of in the hospital environment that might be containing a j or a ch sound?
Many.
Yeah.
I mean, the problem with medicine is there's lots of complex words derived from Latin and other things. So
that word tube, actually, even though it's a T,
tube,
that ch sound in it.
Yeah, communication challenges would be another one. Yeah, gynecology. Yeah, those sort of things. So yeah, there'd be quite a few. There would be quite a few words where it'd be worth trying to practice that.
I think so. I think that would be a good way to approach it, is to really hone in on the words that are going to come up a lot every day for Oleg, just to make sure that in the work environment people do really understand exactly what he's saying.
Do you ever recommend with your clients them watching certain things like Australian movies or any sort of professional videos or anything like that to help, or does that benefit people generally?
I think it does, certainly for language skills and also watching the mouth position for particular sounds. But when it comes to learning, you know, a specific sound like that, some people are going to need a little bit more, you know, hands-on approach with someone to help them learn. That can be a bit of a tricky one to learn, the ch and the j sound. So I use a technique called prompt, which actually is a hands-on technique. But there are lots of other different strategies that we can use with individuals for teaching them those particular sounds. But yeah, certainly English movies with subtitles can be a really good way of practicing and just listening to the language, because often people, in addition to having difficulties with their accent, will report they have a bit of a challenge with comprehension and keeping up with, you know, some often very fast speaking people. And I guess in the context of working in a hospital, sometimes you're dealing with very sick and unwell people. They can sometimes be a bit challenging to communicate with.
Absolutely, yeah. I actually kind of counsel people that learning the professional version of English is kind of just the first step to getting through the English language requirement for medical registration and getting through an interview successfully. Usually you're on more of a common setting with the other people around the interview panel, but then when you're in the hospital, there's a much broader range of accent and use of language and idiom, particularly with some of the patients you might encounter.
Yeah,
and sometimes it's straight out the patients you're encountering are from a non-English speaking background as well, so that makes it even more difficult.
Yeah, that's right. Yeah, so some of the language they might use, you know, I was feeling sick as a dog. Just brushing up on some of those sayings can be helpful as well.
Feeling crook, that's another one.
Feeling crook. So, Anthony, was there anything in particular that you noticed in Oleg's answer that he could improve on in terms of the content?
Yeah, look, again, I think the right content was there, thinking about the skills that he could bring, and he was giving some good examples of things that challenges or problems that he'd been able to solve or meet. Again, that's something we're looking for as an employer, that you can do those sort of things. A nice thing to do in these sort of circumstances is to actually maybe try and turn it back on the panel. You give your kind of key skills that you think meet the job profile as you understand it. Then you might actually ask them, you know, is there a particular challenge that in your hospital that you're looking to deal with that I might be able to talk about how you know, I can help with that, or would be able to do that? You know, what's the biggest problem that you find trainee doctors face when they come and work for you for the first time? And I can talk about how I might deal with that problem, or how I've dealt with that problem in the past. Again, what that's doing is getting the panel thinking about how it might be like to work with you. So future thinking, engaging them, and oh, this person's actually quite interested. Another thing you can do is kind of sort of say, look, I've been looking at your hospital, I noticed a few things, you know, wondering whether my skill fits that. That's another way of sort of showing that you're very enthusiastic and you've done your research. Yeah.
Awesome.
Yeah.
That's a great tip.
Okay, so there's a couple of sort of examples of accent and content issues for overseas doctors looking to work in Australia. Any sort of final tips you would have for international doctors that might be wanting to sort of improve their performance at the interview, or just their Australian English in a general sense from them?
Yeah, so I think there's a lot of things that people can do to improve their accent, but one of the things I do notice is that Some people, when they learn English, they're taught to use an increase in tone, like a high rising tone for every question. So they might say, where is that drink? What do you want? For every question. And I think what it's important to note is that actually we only really use high rising tone in English if we're unsure or we're requesting clarification on something, or if we want a yes/no answer out of someone. So anytime you're using a question that is like a WH question, like where is, or how is, or what do you want to do, you actually use a dropping tone in your question. And anytime we use a statement, we always go down in our tone. And I think the problem that can happen is that if you're constantly using rising tone, you can sound a little uncertain to us, and it can kind of put off the listener to think you actually don't know quite what you're saying, or you're wanting me to clarify for you. So particularly in the context of an interview or in a professional context, working as a doctor or in any other professional context, you really want to feel or project that you do know what you're talking about and that you don't necessarily need clarification on everything you're saying. So I encourage people to use a lot more falling tone and then rising tone. So I've created a little cheat sheet on this, which I can pop up on my website, which is just on intonation. We call it sentence level intonation. That gives you, when to use rising tone, when to use falling tone. But that's one thing I have noticed that people really can get tripped up on. I guess the other issue is in the vowel sounds. So a lot of people really can struggle with the vowels. And in particular, I guess, in English, we use a lot of long vowel sounds. So E and R and oo. And it can really change the meaning of the word if you get the vowel short, shorter than it should be. And I think a lot of people in their home languages, they don't necessarily have long vowel sounds. So, your natural inclination is to change, heart to hot. And you can see that can be quite confusing, particularly in a medical context, if you are not making that vowel long enough. And when I'm doing coaching sessions with people on this, you'd be surprised how long you need to make it to really get that message across. And just to remember as well, like if that is a stressed word, like an important word, it has to be even longer. So I think just go nuts, make your vowel sounds as long as possible when there's a long vowel sound in there, and that can really help out our English ears. So was there anything else, Anthony, that you wanted to give people any tips on in terms of interviews or their communication skills in the medical context?
Look, there's a number of things I could say. Probably one tip for anyone coming from another country actually wanting to work in Australia is when you put together your CV, your curriculum vitae for a job, a funny thing about the Australian context is that employers will ask you for a CV, but they're actually asking you for more like a resume. So just to explain that, a proper CV in some countries, or the proper meaning of a CV is basically everything in your career. So it's actually quite a long document. Whereas a resume, if you go to the other extreme in the American context, is allegedly meant to be no more than 2 pages. In fact, maybe less if you listen to some people. So a resume is kind of tailoring your career profile to the job. Australia is somewhere halfway between, but we ask for a CV, so it's confusing. So it's hard to give you an exact length about what that document should look like, but it's definitely not if you're from a country where you're used to submitting 20 pages, it's definitely not that. It does need to be relevant to the position. So again, that might be something that you want to get some advice or assistance around, because it is a bit confusing for people, particularly if you're used to a different context for what a CV might mean. So that's just one tip.
Not too much information, but don't make it too short.
Yeah. I say it should be as long as it needs to be.
That's right.
Yeah. All right, well, that's been a really good conversation. So Bron and I are hoping to do some more collaborations, so we'd love to hear some comments and feedback about this particular video. Drop them in the description below. Subscribe to Bronwyn's channel. We'll put a link up for that. And will be a link on Bronwyn's channel to my channel. We hope you got some good tips out of this video.
Yeah. Thank you, everybody, and all the best with your interviews and your career.
Bye for now.
Bye.